Good evening, dental internet world. My name is Dr. Vishal Sharma, and I'm once again here alongside my friend and co-podcaster, Dr. Mike Parchewski. What do you think?
Sure. Let me ask you one more question to follow up. It's something I've been noticing over the last few weeks. Everybody's heard of Chat GPT, AI engines. You know, you can write your high school essays now. AI is a big topic, right? It's all over Instagram. It's all over the media. And I feel that AI in the next 2 years is going to be a huge piece of what's happening in dentistry. And for good or bad, AI is going to come in. And whether it's a disruptor, however it's going to be working. But I've also seen some of these big tech startups. One of the big tech startups is actually a medical device company that's using the AI technology with a fully robot-operated surgical facility that would then do the operation. So, here's the question. I feel comfortable with this whole AI nervousness that is out there, that as dentists, we still won't be replaced for some time soon. But tell me, what's your take on AI? Where do you feel it's going to fit in dentistry? And should kids be worried that there's going to be robots taking over their jobs?
And this is a much more deep conversation than PRF, but let's jump into it. So working backwards, I think that the profession is going to monumentally change. And I think that dentistry, for people maybe looking to get into it, is going to be a little bit less appealing because of the AI nature. I think that the technology will be quite disruptive to a lot of the things that we have the capability of doing. We'll still be managing some of it, but I think the infrastructure and manpower required to satisfy the dental needs of a population will need less people doing that. You've been working and beta testing and serving as a KOL with a company that's doing a lot of AI aspect in the diagnostic component. And so, diagnosing pathology on CBCT and x-rays, you can see how just big data is going to enable AI to, at the very least, significantly support consistency. So that'll aid dentists in having less variability with treatment planning. And then even from a component on a restorative aspect. So as you know, I really like my hard tissue laser, and we utilized it for a few cavity or decay removals today. If you've got software technology that's able to map out that cavity visually, we're big into the Spectra at our office, and you can pre-map that out and just have that laser, as they already do in dermatology or plastic surgery, basically lasering and activating over a pre-mapped area. The entire restorative component, short of the actual placement of the restoration, is done.
Yeah.
And, now if we are utilizing scanning technology and printing these resins and restorations, I think it's probably not that far away. Now, thankfully for you and I, with slightly receding hairlines and lots of gray hair, we don't have maybe as much runway on our career as other people do. But I think it's really exciting. I love technological disruption to any profession that makes it more efficient, progressive. Do better is sort of the motto of you, I know, and it's sort of the same with me. There's a better way, find it. So it'll be really interesting to see how the profession changes, but it will change undoubtedly. And I think we're one of those aspects where things are going to change and make the need to have as many dentists less important.
Yeah.
Yeah. Your thoughts, Mike?
Well, that's a great summary. I feel the same way. For example, but where I see it exciting right now, I think there's a lot of excitement, and where I see this excitement is, for example, you've got OraQ, which is doing risk management and looking at risks. You've got Pearl, Overjet, and Denti AI that are doing radiographic. You've got DiagnoCat, which is doing CBCTs, and all of those make what we do easier, but also it allows the patient to be a part of the process. And I'm a big believer in the patient being involved in case presentation and case acceptance. So by making the patients be able to see, hey, look, it's highlighting in red these cavities on the X-ray, and it's sort of pre-populating a list of cavities, patients are much more supportive of that because they visualize it. And visualization is so important. The other place I see AI, we've already seen AI helping our CEREC designs. If you were a RedCam user and now you're using the Prime Scan, it's way easier nowadays, right? So for somebody to get into CAD/CAM dentistry, most of the work's done for you, and it's learning constantly. And then in the DS Core, I feel that, you know, from some of the rumors and what I hear happening in development is that AI is going to become a big piece of it. So for example, you've got a case that you want a night guard for. So you upload into DS Core, you put it into the DS Core design software, and it designs you the night guard. Boom, you print out your STL file. And it's already being done. Like SprintRay already has a little bit of that going on. Some of that's still going through a technician. But what you're going to see is better proposals, better accuracy, and faster turnaround, so that I can, like right now, I can have a patient walk into my office and I can mail them a surgical guide and place an implant on them in 45 minutes, right? Which is pretty cool. But it's going to continue to be that way, where your time for diagnosis and results is going to be so fast that a patient can walk in and you could diagnose what's happening, figure out the plan, and actually they walk out with it completed. So my feeling is that there will be a much faster turnaround and access to potential, you know, therapy in a much faster manner, which if you're already on the crown in one appointment and that type of thing, you're already seeing that early inception of that. But I just feel that that speed of turnaround is going to continue to be that great.
Yeah, and I would agree that the continued automation or the more objective component to diagnosing will only serve the profession more effectively, you know, and that's something that you've obviously been working on, which is really exciting. So I'm excited to see what happens with it. It's not an area that's a detailed expertise of mine. We are starting to use a little bit of AI software is our plan imminently. In fact, we've got a meeting on it next week on some of our patient communication.
Okay.
So we're going to see what that, you know, no pun intended, spits out. But it's an exciting time, and it seems to be a hot topic of conversation. So if you're into technology and progression, AI is certainly the way to go. Wrap up on that component. Thanks once again, everyone, for listening. Wishing you a happy new year, and we will see you at podcast number 30 coming up.
Right on. Thanks, everybody. Remember, like and subscribe. And anybody's looking for us, Digital Dentist on YouTube, at Digital Workflow Dentistry on Instagram, digitalworkflowdentist.com. Anything you need, let us know, and we'll be happy to help you out. Thanks, guys.